Good evening, everyone. Welcome to 360 Event Center. I'm your host, Atabu Rahman. Today, we have the special topic to discuss about the alternate view of COVID-19. What does it mean? We'll hear about it. Let me welcome our moderator and co-host with me, Mr. Ajoy Ghosh, tonight. Ajoy will be with us soon. Mr. Ajoy, can you hear us?
Yeah, I can hear you well.
Thank you so much. Mr. Ajoy is a cultural and social welfare activist, and he has volunteered today to hear and share the alternative view of COVID-19. Let's go for the discussion. Mr. Ajoy, can I ask you to introduce our other respected guests and speakers tonight?
Sure. Hello, everyone. Hello, viewers. I'm Ajoy Ghosh here. And we have today two guests with us. Both are from the alternative medical practices. One is Dr. Naveen Shukla. He is an Ayurvedic doctor, and he has a Bachelor of Ayurvedic Medicine and Surgery. He is a yoga expert and professional member of AAA, which is Australian Association of Ayurveda. And he's also um, Vice President of Australian Association of Ayurveda. He's recognized as a naturopath and nutritionist by Complementary Medicine Association over here. Welcome, Dr. Shukla, over here. How are you today?
Thank you very much.
And
I'm good.
We have other respected participant is from India, and Dr. Rajesh Kumar Goel. Dr. Rajesh Goel is a renowned and very famous homeopath practitioner back in India. He has his practices in Delhi, and next to Delhi is Faridabad, both places. He has been attached with the Navjyoti Clinic, which is a de-addiction center run by the Delhi state government for rehabilitation and de-addiction with the corrective services. He's been also a consultant with the SRF, and he's been represented India in the SARC missions as an NGO during 2002 SARC summits. So welcome, Dr. Goel. How are you today?
Thank you. Very fine.
Okay, viewers, we have today a few of the things which people are eager to know about, and I will be asking most of those type of questions, like how the alternate medicine is beneficial during this pandemic or this time we are going through, the world is going through. So let's start the talk from the very beginning, and let's see what's their opinion. Now, should I start with Dr. Shukla, with you?
Yeah.
All right. Okay. Dr. Shukla, I will probably first question ask you, and same question for Dr. Goel as well. But first, Dr. Shukla, what is your opinion with this pandemic or COVID we are going through it, and how the alternative medicine, the practice you do with Ayurveda and yoga and all that, how we can cope up with that, how it is useful?
Look, Ajoy, the principle of many of the natural healing system nowadays we are using, all are same. The roots are same. Basically, we depend upon to increase our immunity. Ayurveda is all about prevention. It is very common saying swasthasya swastha rakshanam aturasya vikar prashamnam cha. I'm just going in the Sanskrit. I will explain it. It is basically how we can prevent and how we can, by preventing from disease, we can live healthy and happy life, which is World Health Organization definition also. So Ayurveda, basically we try to prevent everything by increasing our immunity and making the balance in our body. Just like everyone has a unique fingerprint. Each
Right.
person has a particular pattern of energy and individual combination of physical, mental, and emotional characteristics, which compromises their own constitution. This constitution is determined at the conception by number of other factors and remains the same for the whole of the life of a human being. So just as everyone is same, so many factor, both internal and external, act upon as us to disturb their balance and are reflected as a change in one's constitution. So health is basically balance and imbalance of all the constitution of our body. Whenever we
Right.
are in a balanced state, we are healthy. When all the dosha means three basic elements, vata, pitta, and kapha, when they are imbalanced in our body become diseased. So Ayurveda work on an individual according to their constituency. We check their constituency with the number of factors, and after then, because of the individual person, the same herb can be used for different person for the different reason. It is not recommended that one herb can be beneficial for the everyone. Only few herbs has been described in Ayurveda, just like an rasayana means rejuvenative herbs for everyone. But it is not that we can recommend everyone the same herb. According to Ayurveda, we first of all, I will explain that while living in Australia, we should follow all the health government of Australian government, all the preventive methods. We should follow all the social distance, all the recommendations given by Health Australia. But at the same time, we should work on to increase our immunity and to balance our life. During the COVID-19, many people has changed their lifestyle by living at home. All going good?
Sorry. Yeah.
Yeah. So, all right. Yeah. Is, is that okay now?
Yeah. Better.
Yeah. So Ayurveda is all about bringing balance in the body. Once our body is balanced, our thoughts are balanced, emotionally and physically we are balanced, we can get rid of all the diseases.
Coming to Dr. Goel back there.
Yeah, yeah,
Same question again. Um,
yeah, definitely.
as
Yeah,
Dr.
certain, certain.
Shukla said, yeah, as Dr. Shukla
Homeopathic.
said, that Ayurveda has actually works on three different things, balancing of three different things. This is Vayu, Pitta, and Kapha.
Yeah,
Right?
yeah,
So, and it same thing can work differently in different bodies because depends upon the balancing of these things, how much unbalanced or imbalanced these are.
yeah, yeah.
Um, what about, is the same principle kind of things work with homeopath, or what I know a little bit about, that it works on the moods of the person as well, like how
Yeah,
things.
yeah. It
Can you
depends.
explain that
Yeah.
exactly and how it is useful with this time, this difficult time?
Desires and the aversion and the liking and the sleep, everything. Individualization is very important in the homeopathy. And we works mainly with the vital force. If the vital force is strong, then there is nothing in your body to give you any kind of disease. So if the vital force is very strong, then you are very much fit. Nothing can happen to you. Okay, this is the main principle of homeopathy. And the second thing is very popular. Individualization is very much important in homeopathy. Suppose a fever patient is coming to me, and the second patient again is coming to me fever. Uh, there is two things in both the patients. Huh? There may be thirst or there may be thirstless. If the patient is thirsty, then there is separate medicine, and if the patient is thirstless, then there is separate medicine. Maybe body ache, maybe other symptoms also. Then the individual thing matters in homeopathy. It's very much important, and the same in other cases also, desires and the liking and the sleep and the dreams. They are very, very important symptoms for the homeopathy.
Right, right. The main question is definitely that's how the medicine you diagnose
Yeah.
for the different people with the different, you know, their mood and their habits or
Yeah.
their body reacts accordingly, right? But how Ayurveda is useful at this point of time when we are going through with this, you know, uh, COVID-19 problem and all that. The whole world is almost like a standstill condition at the moment. So people definitely thinking in different manner. Lots of people believe only in Ayurveda. Lots of people believe only in homeopathy. Lots of people
Yeah.
believe only in
Allopath
combination as well,
combination.
and lots of them allopath as well.
Yes.
We have few doctors back in India who also give you combination of things with biochemic and others. So my question is, uh, I mean, how it is going to help out with the homeopathy at this moment?
Homeopathic is a immunity boosting medicine. It works on the immunity. Vital force means the immunity. If the body's defensive system is strong, then there is nothing, whether it's a virus, whether it's bacteria, whether it's some kind of parasite. We create the immunity against the particular
Right.
infection, right? So this time also we are doing the same thing. We are doing best for the immunity boosting system, and Ayush Mantralaya also suggested some medicines. One is arsenic album. They have suggested arsenic album 30 for 3 days, empty stomach morning, and repeat it after 1 week. Again, we are on the immunity boosting side.
Right, right. Okay, you just mentioned about the Ayush ministry and all that.
Yes.
We have seen recently some videos. I think, Atabur, if you have that video, in case, if you can play that video, then I can go ahead with the question about what exactly we are looking for. Oh, is it? Oh, is it? Okay. 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 All right. All right.
Just show the.
There's,
Just show. Yeah.
just put the mute video and I can talk about that a little
Yeah.
bit, what exactly it is.
Some of the states they are using homeopathic and other system also simultaneously, Ayurvedic also. And the Gujarat chief of officials, she also claimed they are going to use the homeopathic medicine, and they have claimed ki, it's good, it's giving good result to side by side with the allopathic system.
Okay, okay. While I'm talking to Dr. Goel, I will just go into a little bit different thing. You have worked with the drug de-addiction.
Yeah, long story.
Yeah, that needs a lot of strong willpower.
Yeah.
To get out of this kind of addictions and all that. And
sure.
you have fixed thousands of people as far as I know.
Yeah, thousand. Oh,
yeah.
Many more.
When we are talking about, because this homeopathic medicine also help to increase your willpower. And this is one of the very strong thing which you use for de-addiction and all that.
Willpower in which manner? De-addiction part or some other
for
part?
de-addiction part.
De-addiction
For
part.
de-addiction part. Because that's what I know only for de-addiction.
Yes.
Also for any other disease, willpower again, your positivity and all that, again,
Yes.
very much needed. How homeopath, as a homeopath practitioner, this can be related to today's scenario?
Willpower is definitely required in every case, whether it's a de-addiction case, whether it's a fever case or general disease case or any kind of pandemic, epidemic or sporadic. This kind of pandemic, if you have the willpower, you can fight better. You can, your body immunity will work 100% more than you have. If your willpower is strong, you can fight better in every manner. And the same with the
Yeah.
de-addiction. Yeah,
Go ahead. Sorry.
yeah, same with the
You
de-addiction.
know why I asked this question? Because of this, lots of people are in negative mode. They have lost that positivity about,
No,
you
no, no,
know.
no, no. Don't lose. No, 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 no. Nothing
Yes.
to lose. Nothing to lose. Just keep it up. Keep it up. Nothing will happen. Destiny is very much decided. If you are here, you means you are here. Live for today. Live for this time. Live for this minute. If I am with you, I am
Now.
with you. Next time, maybe or may not be. This is
Right.
my perception. But be positive towards your life. If you are living, you are living. You are not, you are not. Everything is
Right.
decided. Some people think
Okay.
I'm here and he went to the Australia and died over there. Oh, no, no. This is basically destiny. He has to die. He has to die in Australia. Simple.
Right.
Just keep it up. Keep it up.
Okay.
Oh,
Uh,
yes.
okay. Coming back to Dr. Shukla. Dr. Shukla, can you hear me? Sorry. Hello. Is it mute? So,
Is it okay now? Actually, I did not notice. Yeah, it might be muted by you. It is still making noise? Yeah. Is it okay? Yeah. Yeah.
all right. Okay. Dr. Shukla, can you hear me now?
Yes, please. Yeah.
Okay. Okay. What's the concept of Ayurveda to identify any disease? You have just talked about this three things of the balancing in the body. Other than that,
Yes.
to make it a bit easier to understand, we have disease, different type of disease. Some are permanent disease, some are long time like diseases. Some diseases are like seasonal, some diseases are like this, what we are going through now. So how do you, you know, differentiate all
Yeah.
these things?
In Ayurveda, body, mind, and consciousness work together in maintaining balance, right? As I was already talking about the balance of everything, your life, your thoughts, your eating habits. So they are simply viewed as a different facets of one's being. So learn how to balance the body, mind, and consciousness require an understanding of how Vata, Pitta, and Kapha work together. So according to Ayurveda philosophy, we have a different tools to diagnose the person imbalance or balance by there is a certain ways tongue analysis, pulse analysis, taking proper history of the person by spending a sufficient amount of time. It can, by going in the past and in the present, we can figure out how the imbalance, just like the pathology starts. It is whatever we are facing at the moment, it is always symptoms, but pathology always far behind whatever happened in the past. So by taking history and pulse and tongue diagnosis, the skin, checking the skin, we can figure out. It is a very big science. It is a very common saying, one can't be an Ayurveda Acharya in a one life. It is always
Vast
ongoing.
sort of subject.
Yes, it is. It is very always ongoing. Still, I was talking to one of my fellow friend in Melbourne. He is very renowned Ayurvedacharya, and he told me there is an doctor in Maharashtra. He is giving very good webinar nowadays. So we are at the moment of COVID-19. We are all of Ayurveda doctor or Ayurvedacharya in Australia. We are doing a lot of webinars with different Ayurvedacharya in India and even in Europe. So it is never ending. Again, come to your question. By all these method, we can figure out which element is imbalanced in the body. First, we have to see the basic constituency by knowing the taste, by knowing the percussions and their evacuations, all those things. There are many ways that we can find out how the imbalance has happened. Then we start working on the balancing all of them by slowly and slowly. And this is how Ayurveda works.
All right, I got that
Okay.
video
And
on the screen. If you guys want to focus on that, I can play the video. That's what you want.
yeah,
Yeah.
if you can please. Yeah.
Okay.
भारत सरकार के आयुष मंत्रालय के सचिव हमारे डॉक्टर राजेश कोटेचा जी के साथ, वैद्य राजेश कोटेचा साहब के साथ आज वीडियो कॉन्फ्रेंस हुई और उसमें भी एक चीज़ की नोंद उन्होंने भी ली है, जो पूरे इंडिया भर के लोगों के साथ शेयर किया गया है कि हमारे यहाँ जो क्वारंटीन सेंटर्स थे उसमें हमने
Meanwhile, Tabor is going to play this video. I probably will go back to Dr. Goel.
I'm playing the video.
Yeah.
Right. Okay. On my screen, I can't see the studio screen at the moment. And I can't see Dr. Goel, Dr. Shukla as well.
Okay, that video is playing. This talk is not going up there. So do you want me to play or you want me to pause?
संशोधन या इस छोटे से एक्शन रिसर्च के
No,
दरमियान
you
हमने
can-
नोट की है
No
कि
noise
11
in there,
लोगों
no
को
voice
सिर्फ
in
3
there,
दिन,
so I
वैसे
can
7
meanwhile
दिन
keep on
तक
talking.
ये लेना होता है, पर 3 दिन तक ही उन्होंने ली थी, फिर ये नेगेटिव आया था, पॉजिटिव आया था उनका, लेकिन बाकी सब 6,210 जितने लोगों में हमने एक इनिशिएटिव पहल शुरू की थी, इनमें से 11 लोगों को छोड़कर बाकी सब के टेस्ट नेगेटिव आए थे, तो इस चीज की भी नोंद राष्ट्रीय स्तर पर ली गई।
Okay, that video.
A decision on around the 6th of March. We had constituted a team of experts and we decided to really distribute what is known as Ukada. This is basically to boost the immunity. It is also called Amrit Pay, a concoction of various Ayurvedic herbs and various medicines, and this has been very popularly received. We have distributed as many as 1,541,000 doses across the population, and it is still being done on a free of cost basis. Similarly, the tablet Samsham Vati, we have distributed as many as 1.72 lakh doses of this. People phone us up at 104, come to the Ayurvedic dispensaries and collect it, which is again offered free of cost to anybody who wants to take it. Similarly, we have provided about 76.72 lakh doses of the homeopathy medicine for boosting the immunity, arsenicum album of 30 potency, and as many 76 lakh 72,000 people have availed of this. The other very interesting experiment that our team has done is that we decided to experiment with those who are in the quarantine centers, which means people who've had a contact with positive patients, but who are completing the 14-day period in the quarantine center. So we selected 179 such quarantine centers, and there were in all 6,210 people there who gave their consent and willingness to adopt by the homeopathy or Ayurvedic treatment to boost their immunity during the quarantine period. So Ayurvedic medicines were given to 3,585 people in the quarantine center, and similarly, as many as 2,625 people chose to go for homeopathy treatment, which was administered to them. It's very interesting to note that out of all these people, none of them except 11 tested positive. I mean, none of them tested positive. It was only 11 who tested positive, and even these 11 people, there is a footnote that our team noted that this experiment was started from 10th of April. We took a decision formally at the government level, but we found that these 11 people were not able to, because the 14-day period was coming to an end, and they were only able to take this dose for a period of 3 days or less, while the actual prescription is for a 7-day period. So they did the test after 3 days and it turned out negative. But the rest of them, interestingly, all of them have turned out negative. These 11 people had a positive test. So this again goes to show that this experiment of providing homeopathy and Ayurvedic treatment or prophylactic immunity boosting treatment to those in quarantine has worked quite well, and this was shared as a national best practice today in the video conference with the Secretary Ayush, Vaid Rajesh Kotecha. Thank you.
Okay. I'm just wondering, like, if we can get some, sort of words from you, that what kind of immunity booster herbs or like this, and how it works. If you can give us a bit of, if you can put a bit of more focus on that. People will love to know
In
that.
Ayur,
Which are safer to
in
use, which are...
Ayurveda, yes, like in Ayurveda, there are a couple of herbs, many herbs we can use as an immunity booster, but they work, again, it works on individual by basis, and before having them, one should have an Ayurveda consultant opinion. I will never recommend that everyone can have, but most commonly, even Ayush Ministry is very much recommending at the moment, which is Guruchi. Guruchi's botanical name is Tinospora cordifolia. In Sanskrit, we always say it as Amrita. Amrita is translated as a nectar of immortality, right? So it has a quality. This plant is bitter and astringent, right? If it is bitter and astringent in this way, it keeps dosha kapha. Kapha is basically responsible for making lubrication in our body, right? It due to astringent property, it helps to reduce kapha in the body, right? In post digestive effect, it is sweet. For this reason, it soothes dosha pitta. Pitta is basically fire element.
Right.
Its power is hot, thus helping to eliminate amine and toxin from the body, and without aggravating pitta, which is also composed of fire. So it basically nourishes and rejuvenating. Due to its nourishing and rejuvenating quality, it has been said that it is anti-aging and rejuvenating. It increase our immunity by that way. Again, second herb is which is very good, which is commonly every Indian use in their kitchen, which is turmeric. It is very good for our respiratory system, very good for our joints. There is no side effect of turmeric. And third, which is very commonly we using ashwagandha. Even in Australia, you can find ashwagandha as a nervine tonic in even at pharmaceuticals stores also. So there are many wonderful Ayurvedic herbs, but I will always recommend to have it them. One should consult an Ayurveda physician, especially in Australia if somebody want to be.
Same thing for Dr. Goel. Like, I know normally, as you said, like everybody is different. Everyone's, immunity system is different. Body responds different way. So, what is your recommendation regarding, what's your immune system?
Definitely, individualization is very different, and one of the most important factor of the homeopathy. But in case of pandemic or any kind of epidemic diseases, you can use arsenic album kind of medicine. We are nowadays advising, and same with the Ayush Ministry also. Arsenic album covers most of the viral symptom, and some other drugs also side by side, like parastox and jalcinum also depend upon the symptoms. But most of the symptom arsenic album covers. That's why Ministry of Ash also advising the arsenic album system, and the other state also using this arsenic album medicine as a preventive measure. Yeah, Gujarat is again one of the state.
Okay. But again, viewers, just remember one thing, regardless whatever the medicines have been talked over here, if you need any kind of, if you need to use any kind of medicines, please refer to your doctor, please consult to your Ayurvedic.
Yeah, certainly. With the specialist. And keep maintain distance, also social distancing and the precautions, mask, although we are not using here because we are separate in the room. But
okay. Now there is a myth, I will say it myth, maybe not reality, because I'm not a doctor, so I don't know exactly, but I want to know your opinion about when we look at the cases happening in US, I mean across Atlantic, US or in Europe, right, and in Indian subcontinent. I'm not bringing China in there because the epidemic started from there, so it was new there, and it was devastated over there definitely at the beginning. But now people know a lot about the behavior of this particular problem.
Yes.
But still, when we look at the affected people, a number of cases increasing, number of people losing their life, they are much more in number. Especially I'm pointing out a couple of countries, like when we're talking about Great Britain. So Britain has, I think, on an average, if you look at how many people got affected and how many people lost their life, I think it's a very, huge number that people lost their life.
Yes.
Recovery is not that much. Then comes with the number of people who are much more than 1 million now in US. Right. Recovery is also very slow, and number of people died is also very high, but less than UK, less than UK. But when we look at the Indian scenario or Indian subcontinent scenario, whether it is India, Sri Lanka, Bangladesh, Pakistan, Nepal, so far, even we are very densely populated, very thick, very high. So there is more chances of getting more people affected, right? But still, there are not many people got affected, and losing the life, the percentage combination is very, very low.
Yeah, here the
Why?
thanks goes to
Is it because of the food habit, or because of the weather, because of other thing? What do you think? I mean, so far no one has got any clue.
First of all, this is possible just because of our Prime Minister Shri Narendra Modi ji, because he created a scenario, educated the peoples to keep the distance and make the your food a bit better, stay at home, social distancing and the masking and the all. He did. Second thing is our food habit. We definitely, majority of people, we are not eating the junk food. The food habit again is a plus point in our scenario. Third thing, we are using the homeopathic medicine, we are using the Ayurvedic medicine, we are using the Unani medicine, we are doing the yoga, we are doing the naturopathy, we are doing some other kind of medicine. और नहीं तो क्या है वो गर्म पानी पी रहे हैं, but we are using it. Somehow we are doing it. So maybe this is my personal opinion.
Coming to Dr. Shukla, sorry, go ahead.
Same side, the Ayush Ministry also just suggested arsenic album, and a lot of people are taking. And the Rahul Bajaj in the Pune, he distributed free medicines, and he recommended he can distribute the free medicine to all over the country. The cost of whole distribution is 650 crore. And he is ready to bear without any charge from anyone on his own. Let's see.
Yeah, Dr. So I will come back to this point again later on, but meanwhile I'll go back to Dr. Shukla. Now I just spoke to Dr. Shukla. I just spoke to Dr. Goel about the percentage people got affected and people losing their life and recovery rate and all that throughout the world. Because you are here in Sydney, in Australia, Australia has managed this very well. Very well. It started actually managing a bit late than others, right? So again, as Dr. Goel said, that credit goes to Narendra Modi. I think over here also credit goes to our Prime Minister over here.
Yeah, sure.
What is your opinion about Australia? Because we have recovered, or we have come back in a very strong manner, very well manner.
Yeah, once again, Ajoy, the same way that Prime Minister Modi has done in India, it was a demand in India because of the huge population. He has to shut down immediately without taking any time. But according to Australian population and Australian needs, most of the Australian, they don't cook at home. And Australian Prime Minister, he took very wisely decision by giving sufficient time to people to make this thing understand that this is going to happen, and he gave sufficient time to prepare Australian people by educating them properly. This was the main key factor. First, he educate all of us so that we can start social preventing with the effective way. And this was the main key that we are safe over here. We can proudly say that we are safe in Australia, and we can be proud of our government decision. Yes. And this is the main key factor, I think.
Just going back to Dr. Goel again, when we were talking about this, Rahul Bajaj from the Bajaj Group.
Yeah.
I think in India, lots of business background people and business houses came forward
Yeah,
for this kind of thing. And
yeah,
also, the community also work very strongly
very
to
strong.
help each other.
Yeah,
India is, as we can see, India is a very huge country with vast population, and the difference, economical difference, is very big over there.
very big one.
Only around 3% I can say are rich people, and then there are about 20% who are middle class, and rest 75% I will say,
Below middle
um,
class.
yeah, lower middle class and poor,
Poor.
right?
Poor.
And then
Yeah.
country has a demography of, you know, ultra modern cities as well as uh, villages which has no basic, you know, facilities even.
Facilities.
So it's
Facilities.
very hard to manage it. Uh, what do you think? Like, is the community and the society so far working well, or is there anything you think is negative also, and how they are going to manage if there is anything negative? Or what's your
Negative.
opinion?
Negative in which manner?
In any manner, like the people are, if not behaving, or if they are not getting the information properly, who they are in the remote
No, no,
places.
no. This time we are getting even each and every people. They are getting the information from the government side or the localites or some medical or some kind of this municipal corporation people sides, and we are getting informed from each and every side of India. Most of the side, not each and every, most of the side we are. And the social and the other thing you asked, what? What?
Yeah, I was asking like how the community is helping out, and the society is helping out,
Yeah,
other
yeah,
than these big
yeah.
groups who are coming forward. Like Tata also said, Mr.
That
J.
also, yeah,
Ratan
one
Tata also said
1,500 crores he gave.
yes,
Yeah.
yes, and there
So
are a
society,
few other.
society also coming forward, and they are donating huge amount to the Prime Minister Fund, and maybe as per the capacity, maybe
Azim
5,000.
Azim
And
Premji also, I think, came forward to do the things.
yeah, Azim Premji and the same Akshay Kumar also 25 crore.
Film stars. Yeah.
Shri Ramdev ji also give the 25 crores, and the many
Yes.
other people they are giving as per their capacity.
Right. Right. Right.
एक्चुअली
Um,
ये तो एक हवन है, इसमें कोई भी एक सामग्री डाल दो और कितना बड़ा डाल दो, तो वो
yeah.
तो बस डालने
Exactly.
वाली बात है. तो इट्स गुड टू डोनेट.
It's
It
good to
depends
know. I
upon
think there are a
capacity.
lot of community program also running over here in Australia, especially for the overseas students. So, Dr.
Okay.
Naveen Shukla, if you want to talk to about these things.
Yeah, like Indian community, especially always in the time of crisis, is always first of all come forward to help in Australia. What I have found before, it was in the bushfire crisis in the Australian communities, the Indian community people, they go united with the Australian and they help them. I got chance to work with few communities over here, just like Hindu Council, Turban for Australia, CIA, many communities over here. They are doing whatever best they can do. Most of the people are sitting home. Some people really they can do everything, even though they're sitting home without putting any effort. But there are some brave people without caring of their life. They are distributing food all over the Australia wherever needy people want. It's not only about the students, it's not about the migrants. Many old Australians, many homeless people, they really get stuck. And
Yep.
these community people, they are helping without any race, without any religion. They are reaching to them and they are going over there. I had a personal experience why during these days I got a chance to, without mentioning any name, to go to their kitchen. I helped them sometime, but I really proud of all of them. And
Yeah, yeah.
this is
I know.
how Ayurveda is Vyavahar, how we have to teach and learn during the time of crisis. As you was talking about
Right.
positive and negative.
Right.
Positive and negatives are always together. So it's not only always positive will work. When negative come, then how we have to react. This is all Ayurveda. Vyavahar karna hai humko. So
Right.
this is
Right.
all about.
When we are talking about, I can, because I live in Sydney as well, so I can probably, I would love to name some of these organization or individuals as well. There are some individuals like
Yeah.
all the gurdwaras doing very good job,
Well,
no
well.
doubt in that.
Even here
And
in
during
India also.
this Ramadan time, also the Muslim community working very hard with them. I know a couple of my good friends. I know Mr. Rashid Khan, who is from Kolkata.
Yeah.
He's getting help from the couple of Indian local business guys who are from the Bengali background. They are helping him. And Rashid himself is a professional cook or chef. So he's doing every day about hundreds of, you know, lunch and dinner boxes and distributing it. And then there is Hindu Benevolent Fund with the Hindu Council. They are doing an excellent job. I think they have done a more than about like 3,000 or 4,000 around, you know, food distribution already, right? And they are going strong, pretty strong. And also Guru Nanak food kitchen, something run by a couple over here, and the community also work with them. They are also doing very good job. A lot of restaurateur in Harris Park area, which is a Little India, known as Little India over here. The restaurant people, we have a cluster of restaurants, Indian restaurants, and what they have done, each day of the week, they have taken as their own responsibility, and regardless how many people want to, they have timing of the daytime and the night time for the dinner and the lunch. People can come during those 2 hours and pick up the free food anytime during that 2 hours in the morning and in the afternoon and late in the evening.
Very good.
So, excellent job, excellent work. Salute. I mean, it's a big hats off to the committee and
same way.
Certain.
Ajoy, same way, Turban for Australia, the Amar Singh, he's also doing very good.
Sorry about that. I should have. Turban instructor. They are doing very good.
He's going to multiple places in Liverpool, in Campbelltown, Wollongong, and now he has opened a Parramatta Council has offered him a Jubilee Hall, and he's distributing every day 5 to 8 bread and butter and milk, and he also distributed about 4,000 meals till today and give hampers to all of the needy people. I have seen him distributing in the Harris Park area. So we should recognize all of them, and thanks to all of them. It's a big hat of Indian community.
Anyway, I think we've been there for about 45 minutes plus. Before we finish off this program for today, I would like to ask both of you, like, if you have any message for the community, the way you want. Dr. Goel, first you go, please. Because you are talking from India, so it's a completely different scenario for you.
Sure. Message from my side to the community is make the social distancing, keep precautions, use mask, and avoid hugging and the shaking of hands. And social distancing is very important. Other than the other side, the medication is again very important. Whatever the medicine you are taking, allopathic or so you can start with the homeopathic arsenic album 30. 1 dose, 3 days, morning, empty stomach, and then repeat it once in a week, 1 dose. This is nothing, just to improve your immunity, boost your immunity power, immunity, and it will help you a lot. Certainly, it will help you a lot. Whatever you are using, homeopathic, Ayurvedic, Unani, you can use. Along with that, you can use this medicine.
Sure. Dr. Shukla.
Yes, Ajoy, while living in Australia, I have found that most of our Australian people, they are fond of going out every morning. They're very, very active people. We go always for the walk, beach, and whenever we got after every school term, we go for the 2-week outing to, some is going to New Zealand, someone going to Nelson Bay, some to the Melbourne. So we got, mentally, we were not prepared for that. But at the same time, we should take it positively that one got a chance to sit in the family, to spend a time with the family, to give 100% to your partner, to your kids, to better understand each other. And if this pandemic will go long, instead of being negative, we should be positive and we should be more supportive to each other by making our life routines bit balanced, go to bed on time, wake up on time, do some breathing exercise early morning to make your brain or mentally happy and balanced, and eat healthy food, because at the moment we are not doing any much physical exercises. Don't be panicked, be in contact with all of your mates, and at the same time we got chance to see our kids what they are doing, because we are so busy. Australian life is very fast. Now we got chance to sit and understand with each other. Be positive, never be negative. This is especially for Australian people.
Right. What's my observation? I will just
stay home, stay safe.
That we have to already follow.
Yeah, of course. before we conclude this program for today, my observation is sometimes the negative become positive. And I looked into this pandemic time into very positive thing like the lot of people, because of their background, because of their thoughts and all that, were, you know, apart from each other, you know, and this actually brought everyone together on the one platform to help each other. We are looking very positively to each other. I think we have um, rose bit,
Rather, you can say
above.
we have come close together.
Yes, we have just been above all those
Oh,
differences now. Yeah, we have just left all
oh,
these things
so
behind us.
we
Yeah,
can justify the presence of others also.
sure. So that's good thing, and I think we should keep the spirit on, and we will definitely win this war. In
Yeah,
past, a
certainly.
lot of things happened in past in the human, sort of uh, history. A lot of pandemic happened, and we survived, and definitely we will survive. We are getting on a better platform, better way. So hopefully we will be all right very soon, and we will be laughing again, back to normal
Yeah,
life.
certainly.
Yeah.
Certainly.
All right. Thank you, Dr. Shukla, Dr. Goel, for
Thank
joining
you.
us, and
Thank
thank you,
you.
viewers, for spending your time to watch this. So we
Thank you.
hope
Thank
that
you very
you
much.
people
Thank
have,
you.
got the message. You people have
Yeah.
got the information, and we will be back again very soon. So,
Yeah.
Mr. Atam, over to you.
Love to all the people. Love
Bye.
to. Yeah.
Thank you.
Thank you very much,
Thank you very much.
Mr.
Thank you.
Ajay, for conducting this show. That was
Bye.
fantastic information. I hope there are lots of valuable information as an alternative we can think of. And of
Sure.
course, this program was run by two doctors in here, and everything we have shared, we have tried to cover to help other people to get an alternative remedy or whichever way they want to take it. And just showing a disclaimer, it's up to you which part you can take and which part you can leave, but there is always good to have some plan B. So that was the plan for today, to have Dr. Rajesh Kumar Goel from
Yeah.
India, Delhi,
Yeah.
from DHMS Homeopath Medicine Doctor, Dr. Rajesh
Yeah.
Kumar Goel. Thank you very much for joining with us. He's the
Mm.
project director of correction,
No,
de-addiction
it is
and rehabilitation and
it is
Right.
ex
consultant
project
with
director.
SRF.
Ex project director.
And also we had today Dr. Naveen Shukla, who is an Ayurvedicharya, means Ayurvedic doctor, and also he's a naturopath. He's also an expert in yoga and also professional member of Australasian Association of Ayurveda, and he's also vice president of that same organization. Also, Dr. Shukla is a professional member of Complementary Medicine Association of Australia, CMA. So thank you very much, both of you, to be here along with our moderator and co-host today, Mr. Ajoy Ghosh. Thanks for your time to joining with 360 Event
Thank you.
Center tonight,
Thank you.
and of
Thank you.
course, day in back in India. So we are hoping that our viewers, they will get valuable information from this show today. So once again, thanks a lot to
Thank you.
being with us today. That was great. Viewers, keep an eye on 360 Event Center when you get time, and we'll bring more and more programs as time goes. Tomorrow we'll have the Australian Bangladeshi High Commissioner in Australia from Canberra. He'll be joining with us in the afternoon. We'll let you know very soon when he's joining with us. So until then, thank you very much to join with us, and keep an eye. We'll be continuing more and more further information for our community for this reason. Thank you all. Thanks very much for joining
Thank
with
you very
us
much.
tonight
Thank
and
you.
today in India. Viewers, thanks for watching us, and we'll include all the information we had today from this program. Thank you.
Sure. Thank you, 360 Events, for
Thank
having us here.
Thank you,
Thank you.
360.
thank you everyone. Thank you and good night to everyone.
Thank you.